Okay, this is the procedure on starting an IV. First, we're going to open up our pack. In it, we've got a towel to use as a drape to put all our stuff on. Okay. And the tourniquet, tape, a ChloraPret, and a Tegaderm. Okay, done with that. First, I'm going to pull off the tape, pull off a big piece, and then tear it in half so you got a good skinny piece. And we'll stick it on the table so we can get to it with one hand. Alright, and then we're going to open up our next pack, get our tubing out, trying not to touch anything. This is sterile, so what we're trying not to do is touch any part of this hub and keep this cap on so that nothing in it becomes contaminated. So then we take our flush, take the top off, get your air bubble out, connect to the blue port. We want to prime the tubing. Make sure it flushes all the way through and there are no bubbles. Okay? And then I'm going to loosen the cap that's on the end so it's easier to get off with just one hand. Okay, I'm going to place it back in the bag in case the cap does fall off. Okay? Alright, now I'm ready to use my tourniquet. I'm going to tie it above my sight. Again, where I can release it with just one hand. Okay, I'm going to take my ChloraPret, squeeze it to break it, then clean my vein from the inside out. Okay, be sure not to touch again after you've cleaned it. Alright, so while that dries, I'm going to put my gloves on. Catheter ready. Okay, take the top off. I'm going to loosen the catheter a bit and be sure I'm inserting with the bevel up. I want to anchor my vein. I'm going to insert at a 35 to 40 degree angle. Once I pierce the skin, decrease my angle slightly until I see blood return. I'm then going to release my anchor and advance my catheter all the way to the skin, being sure not to touch the insertion site or the inside of the hub. Once that's in, I want to pop my tourniquet, anchor, occlude to keep the blood from pouring out over you. In the hospital, you would retract, but we're going to save your needles. Okay. Alright, so now we want to take this off with one hand, connect here. Put it on, be sure not to touch your insertion site again. Once that's screwed on tight, we can aspirate for blood return and then flush to ensure we're in the vein. If it flushes well, take my piece of tape, place it over just the hub, not touching your insertion site, and this acts as your stat lock. I then want to place my Tegaderm, which is sterile, over the insertion site. Okay, and then as you see here, you're going to initial, date, and gauge. Alright, I will tape up here again and remove my syringe.